All right, let's get into this. We're on a quest for the perfect dose. You know, we tend to think of medicine as pretty simple, right? Take one pill twice a day. But the real story is so much more complex and, honestly, way more fascinating.
So, have you ever really thought about this? A medication might be a total game changer for your friend, but for you, maybe you get weird side effects, or maybe it feels like you're taking nothing at all. Well, that's not just a fluke. It's actually one of the biggest challenges in medicine. And today, we're going to unpack exactly why that happens.
Okay, so it all kicks off with what we can call the dosing dilemma. This is the puzzle every single doctor is trying to solve. Because here's the thing, the success of any drug therapy really hinges on getting that dosage regimen just right for each and every person.
You know that dose you see on the bottle? Think of it more like an educated guess. It's a starting point designed for some average patient. But let's be real, who's actually average? Our bodies are all so different in how we process drugs, which makes creating one universal dose, well, pretty much impossible.
And what's wild is just how many things are in the mix here. I mean, your age and your weight, that's just scratching the surface. Got other health issues? Doctors call that pathophysiology. Your personal genetics can make you burn through a drug super fast or really, really slow. And yep, even other medicines you're taking or what you had for lunch can completely change how a drug works in your body.
So with all these differences, what is the actual goal? Well, clinicians are basically on a constant hunt for what you could call the Goldilocks zone. You know, a dose that's not too high, not too low, but just right.
And in medicine, this Goldilocks zone has an official name. It's called the therapeutic range. It's that perfect sweet spot where there's enough of the drug in your blood to do its job, but not so much that it starts becoming dangerous.
And this chart is a fantastic example. We're looking at the asthma drug theophylline. That perfect zone is right there between 10 and 20 micrograms per milliliter. Each one of those dots is a real patient. And you can see it plain as day. Once you go above that range, the risk of mild, serious, or even severe toxic effects just shoots through the roof. So yeah, getting this wrong isn't a small thing. It can have seriously dangerous consequences.
But here's a really crucial point. Even this range is more of a guideline than a hard and fast rule. It's all based on probability, on what works for most people. Some folks might feel great at a level of 9, while someone else could start having issues at 21. The range is the target, for sure, but what really truly matters is how the individual patient responds.
Okay, now let's raise the stakes a bit, because for some drugs, finding that Goldilocks zone isn't just a good idea, it is absolutely critical.
Yeah, with these particular medications, the margin for error is razor thin. We're talking about a tiny difference in concentration being the aha moment between a treatment that works and a really serious side effect. The official term for these is critical dose drugs. You might also hear them called narrow therapeutic index drugs, and it means exactly what it sounds like. Tiny changes can cause huge problems. Either the drug just stops working, which is a disaster, or it becomes toxic, which is a whole other kind of disaster.
And these aren't some rare, obscure drugs. We're talking about really common, important medications for things like heart failure, bipolar disorder, and seizures. Just look at the range for digoxin, 1 to 2 nanograms per milliliter. That is an unbelievably fine line to walk.
So when the stakes are this high, how do doctors and pharmacists handle it? Well, they don't guess. They have a very clear process, a kind of safety playbook to get it right. So how do they actually do it? How do they get from this super complex problem to a solution that's tailored just for you? It's not about luck, it's a very systematic approach. The playbook is called therapeutic drug monitoring, or TDM for short. So first, they'll design an initial dose based on things like your age and weight. Then, and this is the most important part, they see how you respond. How are you feeling? After that, they'll actually measure the drug level in your blood, have an expert analyze it, and then, if needed, they'll tweak the dose. It's this constant feedback loop.
And this is exactly why it matters so much. TDM is this amazing tool that lets us move past that average patient idea and deliver care that's built specifically for your body and your needs. It just makes the whole treatment safer and a heck of a lot more effective.
So let's put this all together and look at what it means for you and your prescription in the real world.
When you look at the official guidance for a drug like digoxin, it says the dose should be determined on clinical grounds. That's a fancy way of saying it's not just about punching numbers into a calculator. It's about a doctor's experience, their judgment, and actually seeing how you, the patient, are doing. And to make that judgment call, a doctor has to juggle all of these factors at once. Not just your weight, but your lean body weight, how well your kidneys are working, because that's what clears the drug out, your age, any other conditions you have, other meds you're on. It's like a unique, complex puzzle for every single person.
And the whole time, they're trying to land you safely inside this tiny, tiny window, less than 2 nanograms per milliliter. This right here is why that whole monitoring process we just talked about is so absolutely essential for a drug like this. So if there's one thing to take away from all this, it's this. Your prescription isn't a final command. It's really the start of a conversation. If your doctor adjusts your dose, that doesn't mean something's wrong. It means you're in a dynamic, collaborative process to find what works perfectly for you.
So the next time you pick up a prescription, just think about the incredible, personalized science behind that little pill. It's a quest to find your unique Goldilocks zone, making sure your medicine isn't just working, but that it's safe. So what's the science behind your prescription? Well, now you've got a much better idea.